Prednisolone, dexamethasone, betamethasone, all the sons, glucocorticoids can destroy your body if you abuse it. It's saving lives, but it's also ruining lives. Let me show you how. Welcome guys to this YouTube channel. A lot of people today abuse steroids thinking that it is solution, but not knowing the dangers. Prednisolone is used to reduce inflammation. It's an anti-inflammatory agent. Inflammation can be defined as localized tissue response to injury, a protective localized response to injury or infection. It ushers in inflammatory mediators that fosters healing. Now, prednisolone, just like I said earlier, can be classified, is rather classified as glucocorticoids. Is mainly anti-inflammatory. Is used to reduce inflammation. Inflammation in conditions like rheumatoid arthritis, because arthritis is the inflammation of the joints. Now, inflammation has 5 cardinal signs: pain, heat or hyperthermia, redness, swelling, and loss of function. These are the 5 cardinal signs of inflammation, which, when prednisolone is administered, it will reduce inflammation. And once it reduces inflammation, all these 5 cardinal signs will reduce. This is why some people take prednisolone because of pain. They feel that it's an analgesic, not knowing the dangers which I'm about to spell out now, which I'm about to reveal to you. During the process of reducing inflammation, it reduces pain. However, that doesn't make it an analgesic. Is a drug, and as such a chemical agent, and should be regulated, otherwise it can be dangerous. Number one danger of taking it is hypertension, high blood pressure. Prednisolone causes salt and water retention, which increases the blood volume, and when it is increased, if not properly limited and managed, it can lead to increase in blood pressure over a long period of time. Hence, caution should be taken when administering prednisolone. Another one is diabetes. Prednisolone, being a corticosteroid agent, causes or makes the liver to release glucose, and it affects the way insulin works in the body. In other words, it causes insulin resistance. If the drug is not limited and appropriate care and management taken, the person can become diabetic. Now, peptic ulcer. It reduces the mucous lining that protects the stomach, then increases the stomach acid production, the production of gastric acid, which leads to excavation or erosion of the walls of the stomach, leading to a condition known as peptic ulcer. Next is avascular necrosis of the joint, especially the hip joint. It causes increased pressure within the bone, intraosseous pressure, increase in intraosseous pressure, which limits blood supply to the bone, leading to the death of tissues around there. In the hip joint, it causes it makes the femur of the it makes the head of the femur to dislodge from the acetabulum. It can no longer fit in, causing avascular necrosis of the hip joint. Reduce immunity. It reduces the immune system by suppressing the activities of the white blood cell. Hence, the individual becomes prone to a lot of diseases, a lot of infections, even mild infection that the body is supposed to fight. The body can no longer fight because the immune system has been compromised. This is also a serious problem. Please kindly like the video, share, drop your comments and questions in the comment section, and subscribe. Thanks. See you in the next video. Drugs are chemical agents. Do not abuse them. Do not take them anyhow unless it is prescribed by a physician. Do not abuse drugs. Always make sure that it's taken under proper medical